Hello, everyone. Welcome or welcome back to another session of A Day with your fertility specialist. I'm Joanna Damina, your host for today. Thank you so much for joining us. We really do appreciate it. Every like, every comment, every click, every share. And on that note, you might want to share this with someone who you think would benefit from this topic. Today's topic, we're going to be discussing delayed parenthood, the risk associated with delaying parenthood, and also the solutions to that. Because everything that we do here is to give you more information so you can make better choices around your fertility. So today, joining us in the studio is Dr. Deborah Olivier. Hello, ma. Welcome.
Thank you very much, Joanna. Good afternoon, viewers, and it's always a pleasure to be with you here.
Yeah, it is. So for those of us joining us for the first time, you don't know Dr. Debbie. Dr. Debbie is an IVF. She's a fertility specialist and also the IVF coordinator here at House Hospitals. So she has a lot of insights for us. And if you're joining us for the how many years time you are, thank you so much for being here. And we hope that you stick around so that you get more information on this topic. So, Dr. Debbie, this week we've been focusing on, I would say, timing when it comes to parenthood and fertility and things like that. And today we're going to be talking about delayed parenthood. What exactly does that even mean?
All right. So when you talk about delay, then it brings up the idea that there's an optimal time for something.
Yeah.
Yes. So like we were discussing on the previous show, there's timing. There's a biological clock with relation to fertility, more so for a woman.
Yeah.
That clock is more pronounced for a woman. So a woman is more fertile at a certain age in her life, and then this fertility starts to decline at a certain age. So by the time a woman is getting to her mid-30s, her chances of having a child begins to go down, her fertility begins to decline.
Yeah.
And that's because a woman is born with all the eggs she would ever use in her lifetime at birth. And each menstrual cycle, a large cohort of these eggs gets depleted. Each cohort of each menstrual cycle, a cohort of these eggs start to develop, and then eventually only one or sometimes two get ovulated, and the rest are destroyed. They become atretic, so that's a decline. The reserve of eggs keep declining with each menstrual cycle. So that's why we're saying fertility has to be timed. For a man, there's also a decline with age, but it's just that it's not as pronounced as that of a woman.
Yeah.
Yes. So the decline with men sets in about the mid-40s, but in a woman from the mid-30s, ovarian reserve, the store or bank of eggs you have left, start to decline. And with this decline, it means your chances of getting pregnant is also reducing. Yes. So that's why when you don't have children at the optimal age, which is your early 20s, going to your early 30s, then we're saying that parenthood is becoming delayed.
Okay.
Yes.
Also, but about men, you said there's also still a
decline with
in that.
age
But
with
can we
men,
go a
yes.
little bit more into that?
Okay, so a man still continues producing sperm. A man is not born with a bank of sperm.
Okay.
Every few months they produce sperm. But with age, there's a decline in the count, the number of the sperm, and even the way they move. And then you see some DNA damages start taking place in the sperm.
Okay.
So reducing the sperm morphology.
Yeah.
And this will also lead to a decline in the ability of a man to get a woman pregnant. So fertility also declines in men, but at a slower rate compared to that of the woman.
Okay. Well, that's actually quite interesting because I know a lot of times it seems like men are potent forever. Yeah.
No, they're not.
Or they're fertile. Let me say forever.
Never, yeah.
So is that amongst? I think that's a misconception.
Yes,
when
it
it
is.
comes to fertility and age.
It is.
Are there other misconceptions that you see, especially with your experience, clients coming in that they feel certain things don't have anything to do with age, just generally?
Okay, yeah. So I think we all this enlightenment, our education. I hope this is changing. But a lot
I
of
hope so too.
women, young ladies, feel they can have children at any time they so wish, but
Yeah.
that is not true. So that's one misconception we've seen. People just feel they can have children at any time. And then
Anytime.
people don't realize that there are certain times in their menstrual cycle when they are fertile. You can't just
Hmm.
get pregnant at any time.
Yeah.
You only get pregnant when the egg is released, and that
Mm-hmm.
happens at certain times in
Okay.
your menstrual cycle. So for women that maybe don't live in the same place with their partners, and
Mm-hmm.
then the man just comes at any time of the month, and you feel because you met, you should get pregnant. So it doesn't happen that way. I
Mm.
think those are some of the myths I've seen regards to getting pregnant and
And
fertility.
fertility, yeah,
Yeah.
okay, well, that's actually important. You're talking about timing. You have to
Yes.
have this understanding of how it
Exactly.
works
Yes.
in, especially before you even going to start. But about delayed parenthood, right? Let's say both the maternal age and paternal age are
Age.
quite advanced. Are there some risks that it may pose to the baby or to the child that they're willing to,
Yeah,
conceive?
definitely. So with advanced age, there are lots of risk. There are lots of risks that the lady is predisposed to. So
Mm-hmm.
with advanced age, the chances of getting pregnant begins to reduce.
Yeah,
And then, the chances of being infertile or having infertility, it's also
increases.
increased.
Mm-hmm.
In this age groups, the time to wait before you even get pregnant becomes more prolonged. So you can see
Yeah.
people trying for years before they finally get pregnant.
Mm-hmm.
And then there are a lot of pregnancy related risks that also increase in advanced age women.
Okay.
Things such as miscarriages are higher,
Mm-hmm.
risk of miscarriages are higher, and then risk of having some medical conditions in pregnancy is also higher,
Mm.
like pregnancy induced hypertension, and then in some cases, and then even preeclampsia.
Wow.
Yes, even gestational diabetes is higher in them.
Mm.
Having babies with low birth weight is higher in them.
Okay.
Even the risk of ectopic pregnancy is higher in
Oh, that's
advanced
interesting.
age
Yeah.
women. And
Mm.
then even for the baby, pregnancy at an advanced age poses a risk to the child because the risk of some chromosomal abnormalities are higher. So
Mm.
you can have children with Down syndrome.
Wow.
Yeah,
Okay.
even children with other birth defects.
Yes.
It's higher at this age. So you can
Mm.
see pregnancy at an advanced age is not something that we readily want to advocate. And that's why we're having this discussion so that
Yeah.
there's a balance. In as much we know that people delay parenthood for a number of reasons,
Mm-hmm.
especially in our contemporary societies.
Now,
In those
yeah.
age, early 20, even before the age of 20s, a lot of
Yes.
ladies are married.
Married.
Even the
Mm-hmm.
men, early 20s,
Mm-hmm.
they are married, they have children already, but it's not the same anymore with our
Nowadays, yeah.
society because of the changes we've seen
Mm.
in our society, because people want to advance their career, they want to advance their education. These are all good, but we're just advocating that there should be a balance.
Mm-hmm.
And if for a reason you can't still have children at the optimal time you should, then you should be thinking about the future,
Yeah.
thinking about what you can do, what options are available to you to preserve for your fertility
For the
for the
future.
future.
Mm-hmm.
Yeah.
Okay. Well, yeah, I know we spoke about that a little bit more in our last session. So if you're joining us for the first time or you didn't join the last one, you can always go back to our page on YouTube, on Facebook, and watch back the live sessions that we've done before. It's not just as it goes, as we go live, then it disappears. So you can always go back and look at that.
Too.
It
Yeah.
has some correlation to do with this as well. But are there lifestyle factors? Like we spoke about the last time, the fertility is a whole, like it's your body, it's not
Yeah.
just your reproductive
Organs.
system, yeah, your
Yes.
reproductive
Yeah.
organs. But lifestyle factors, how do they affect, or do they even affect fertility decline?
Yeah, they definitely do.
Hmm.
So having a healthy lifestyle helps.
Yeah.
Yeah. So some um lifestyle that are not so healthy, like smoking,
Hmm.
excessive consumption of alcohol,
Mm-hmm.
a sedentary lifestyle that you now become obese. Yeah,
Yeah.
all this can impact negatively
Mm-hmm.
on your reproduction. Yeah, and then beyond the lifestyle factor, even for someone that has a healthy lifestyle, age will always set in. That's just the
Definitely.
biological
Mm-hmm.
clock
Yeah.
that God has put in a woman and in a man. And there's
Exactly.
really, but with unhealthy lifestyles, you can speed up
Mm.
this biological clock.
Yeah.
You can speed up the decline in your
Mm-hmm.
fertility potential and reproductive ability.
So you're
So
basically
an
aging
unhealthy
yourself.
lifestyle can speed that up.
Yeah.
Yes.
You're basically aging yourself faster than
Exactly. Yes.
what was
Yes.
timed out for you
Yes.
there. And I know some of these other things. How about stress?
Yeah, stress
Sleep, all
very
those things.
unhealthy.
Hmm.
Stress that is not well managed.
Yeah.
Yes, yes.
Okay, well that's
Because stress
something.
predisposes to a lot of issues, high blood pressure,
Hmm.
sleep disorder, and so
Yeah.
on, and all this will impact on your fertility.
I mean, I just asked that because I know that nowadays, nine out of 10 times you meet someone, how are you doing? Ah, I'm tired. I'm
I'm
okay, but I'm stressed.
stressed.
I'm stressed. So it's something
Even small
important.
children tell you they're stressed. God help
Maybe
us
their homework is too much.
for them.
But yeah, that's also something to think about. Just because
Yeah,
you're trying for something, or you're striving for something in life, that constant stress can actually
yeah,
age everything that you're trying to
yeah.
do faster than.
Unabated stress is not
Yeah.
good. Yes, yes.
So, but for like fertility, when it comes to testing, partners or individuals that are looking for it, how important is that in regards to knowing their potential for fertility and how to preserve it?
Yeah, so it's very, very important. Evaluation is very important, especially for a man or a woman when you notice that you're beginning to advance in age and you're
Yeah.
still not yet ready to start having children. It's good you go for an evaluation to even know what your baseline fertility
Exactly.
is like. So there are various tests we can do. Yeah, we could do a scan for a woman to look at her ovaries. This gives you an idea of our ovarian reserve when you look at things we call the follicular count,
Okay.
and then you look at if she has any pathologies in the ovaries that could
Mm.
also further reduce her ovarian reserve. Pathologies like cysts.
Okay.
Some people have what we call
Mm.
endometriotic cysts in the ovaries. All
Mm.
this can reduce ovarian reserve, and even some people that have some conditions such as polycystic ovarian syndrome,
Yeah.
that also impacts on the ovaries and the eggs. So that could reduce our ovarian reserve. Then other further testing you can do to even to really know what her reserve is like is something we call anti-Mullerian hormone,
Okay.
AMH. So that measures the woman's ovarian reserve, and you get a number which you can use to explain, oh, your reserve is okay, satisfactory, your reserve is low, your reserve is very low, or your reserve is optimal. So that can be done. So all that helps us to have an idea of her baseline fertility ratio. So if you get
Exactly.
a very low AMH, you need to tell this one you need to do something about your
Now.
fertility now.
Yeah.
Yes, even if you were considering delaying parenthood, this might not be the best decision to make for you. You might
Yeah.
need to have a child now, or look at options of preserving your fertility,
Fertility.
looking at things like oocyte freezing, egg freezing, or embryo freezing.
Okay.
And yeah, and for a man, we check their seminal fluid analysis. So the various parameters will tell us if their sperms are optimal or healthy or not. We look at the count, look at how they move, the motility, and then look at their morphology, their appearance, how many are normal. So all this will give you an idea of how the man's sperm is,
Yes.
which you can use to predict his fertility.
Okay.
And then further testings can also be done for a man, things like the DNA fragmentation index.
Oh, yeah, you
And
mentioned
that's what
DNA.
happens with aging. That's
Yeah.
what's one of the things that happens with age to the sperm. The amount of abnormal DNA fragments in the sperm increases, and this damages the sperm. Those sperms are not potent to fertilize the eggs.
Oh, wow.
And even when they're able to fertilize the egg, the chances of those embryos continuing till you delivering the baby is quite low. So you can have higher risk of miscarriages in the woman with if pregnancy happens with those kind of sperm. So
Yeah.
those are some of the things we can do for a man to gauge a man's
Human
fertility
fertility.
potential. Yes.
Okay, well, I mean, that's quite important because then you know what decisions to make, how
Yes.
soon to make those decisions,
Exactly.
and how
Yeah.
you can
Yeah. In
preserve.
recent
Yeah.
times, I had a young boy. He's not married.
Mm.
Yeah, still trying to get his feet in. Get his feet
Standing line.
standing
Yeah.
in life, and
Mm.
he did his SFA, seminal fluid analysis, and the count was very low.
Oh, wow.
Yeah, and so we had to talk to him about fertility preservation, freezing
Mm.
his sperm. Yeah, but
Already.
before we did that, we did other evaluations, then placed him on some medications to try to boost the sperm. And he has come back and he has frozen the sperm now. At least he has options. He has fertility options in future. At least
Yeah.
he has preserved an option to still have a biological relationship to his children in future, so that even if the sperm continues to deteriorate, he has
Yes.
banked something. He has something
Exactly.
banked
Yeah.
that he can fall back on
Yeah.
to use in future.
I mean, that sounds very effective, Like, I was even just my next point, talking about how effective such fertility preservations like the egg freezing, sperm freezing, and embryo freezing can be for delayed parenthood in general.
Very, very effective.
Yeah.
That's what we're advocating now. Very, very effective, because delayed parenthood is something that is here with us now. You see a lot of ladies, a lot of men getting married much later in, in
Yeah.
age,
Yeah.
in the years, yeah, because the kind of society we have now, people want to find their footings, both economic wise, in terms of their career, you
Mm-hmm.
know I don't think any parents, if someone wants to come to marry your daughter, someone that can't take care of themselves, then you think of how
Exactly.
you going to take care of my daughter, and then if a child
Yeah.
or children
Should
come
even
into
come.
place. So
Mm.
yeah, so we understand all those dynamics, but we're saying there must be a balance. And if that balance cannot be attained when you are in the prime of life, when your fertility is at its maximum, optimum,
Yeah.
then you should consider preserving your
Preserving.
fertility. And the
Mm.
methods are very, very effective.
Mhm. And I think it's important that, especially talking about this young man that you've just seen
Yes.
recently, it's important for our viewers to know that you're not too young per se.
Yeah, because there are things,
Yes.
yes.
Once you're already in
Yes.
that reproductive age and
Yes.
reproductive, it's you can always go, and even if you don't want to do anything about it at the moment, you can still go meet your fertility specialist and have a view of
Yeah.
what your fertility potential can be like or is, because I mean, you're looking at somebody in their early 20s and already sperm
Yeah, and
count is
thank God it
already
was just
low.
an incidental thing. They found
Yeah.
a mass in his scrotum, in the
Hmm.
testes, and the doctor said, "Oh, let's
Let's
check your
check.
SFA." And thank God that doctor was aware and
Yeah.
referred him that you should have your sperms frozen. Yes.
So you can
Hmm.
imagine, I mean, especially in our age, I know people that, and I'm going to go into this, I'm going to ask about this a little bit more, but younger people are getting to have more advanced age related issues nowadays.
Hmm.
Are there specific conditions that are associated with aging or, being advanced in age outside of just fertility, like you've mentioned, the lower
Yeah.
ovarian reserve, other medical conditions that can still affect fertility when it comes to age?
Yeah, so conditions like communicable diseases, non-communicable disease, like diabetes.
Hmm.
Diabetes affects the sperm. High blood pressure affects the sperm.
Wow.
Yes, so even those conditions, obesity
Hmm.
lowers a woman's fertility potential. Obesity makes a woman not to ovulate as she should,
Oh,
can make
wow.
your menses irregular. So a
Okay.
lot of issues, and then
Hmm.
a lot of in our environments, like there's a lot of pollution in the environment that
Yeah.
affects the gonads. You just
Hmm.
wonder, people's fertility potential are not as optimal as they were in years back. You just
Mm-hmm.
wonder what is really affecting. You see young couples, young ladies, you do their AMH and it's already low, and you
Mm-hmm.
wonder. You
How?
do see
Yeah.
a young man and you check his sperm, and there are a lot of issues already.
Hmm.
So there are a lot of pollutants, toxins in the environment, things we take in, plastics, the way they affect the gonads, all these plastics, drinks in plastic, using
Yeah.
plastic, yeah. So all that. So in our today's society, there are a lot of unhealthy things that we're doing, a lot of unhealthy lifestyle,
Mm.
that impacts on fertility in a larger form now,
Yeah.
that we're not even, they were not even there before.
I mean, before everything was, I would say
Was
simpler. Yeah,
natural.
everything was more natural. You're
Yeah,
getting
yeah,
things directly from your
yeah,
farm, or you're going to
yes,
markets
yes.
where other people have farmed, and then there's less of that processed
Processed, a
foods
lot of
and
processed
yeah.
things now, yes.
And I know it's more, I know how convenient it can be to just go into a store and just get a processed meal and just have
Within a
that.
few minutes, you've
Exactly.
whipped
You
up
don't
the
have
mo.
to wait. But
Mm.
thinking about yourself, your health, even if it's not fertility specifically, at least just your health in general, these more natural ways of going about things and
Yeah,
avoiding all of these processed foods, I feel like it helps a
yeah,
lot
definitely,
better.
it does, it
Yeah, and then
does.
of course with the healthy lifestyle, your fertility chances are also
Improved,
improved.
yeah.
Okay. But are there, let me see more on my generation. We think a lot about mental health. Yeah, mental health, emotional health,
Yeah.
psychological health. How does this affect an individual or a couple that is trying to conceive or their fertility?
Definitely, mental health is very important.
Yeah.
When you're anxious, when you're depressed, this
Mm,
distorts your hormones,
yeah.
and so it sets up a vicious cycle in the body. So that's no, we like we tell our women, especially women coming for assisted fertility, you need to try and remove anxiety from the process, because
Mm,
it doesn't help the process.
yeah.
Yeah, so definitely mental health, being in a good headspace is very important, being in a good emotional space.
Mm-hmm.
So you see women that are properly supported, they tend to succeed more.
Oh
Women that
wow.
have
Okay.
loving, supportive partners,
Yeah.
they tend to succeed more. So we
Mm-hmm.
advocate mental health is very important in fertility. very, very important, because your mental health has to do with hormones in the body.
Oh, okay.
And some of the hormones necessary for reproduction can be distorted because
Mm,
a woman is depressed or
yeah.
overly anxious and so on. So having a good mental health is very
And
important.
I think that's also something that I see a lot more recent in recent years. Especially with younger people, you're thinking about so many things. Like you're so anxious about what tomorrow brings. You're so
Yeah,
anxious about how the next step that you're about to take, and you don't even know how these little things can affect you as a person apart from just your mental health. If you're not dealing with that properly, it begins to show in your physical as well.
definitely.
Yeah.
Yes,
So
yes.
wow,
It
that's
even
quite
affects your
interesting.
output, begins to
Hmm.
show in your work,
Exactly.
affects
Yeah.
concentration and so many other things. Yeah.
So, apart from these live sessions that we do, and we really do love doing this, educating you and giving you all this information and knowledge, do you think there are other ways that we can better educate young people, especially young adults, about their fertility prospects?
Yeah, so I think we do that in our clinics,
Mm-hmm.
as many as much opportunity we have as we interact with these young people.
Yeah.
We bring it to the forefront and let them know, as we see women in their mid 30s, part of their family and social history, asking, are you married? Do you have children and all that?
Mm-hmm.
We also inform them. So apart from this platform, which is quite good, on a personal level too, we educate and inform people, especially even people that come for other conditions, it might not be fertility related,
Yeah.
and come to the hospital. So use any opportunity we get
Okay.
to interact with people we feel in that age group. We
Mm-hmm.
use it to educate them.
Okay.
Yes, so that they know that there's a biological clock. You don't have all the time.
Yeah.
There's a time that your fertility is optimal as a woman and it
Mm-hmm.
begins to decline. So
Mm-hmm.
while it's optimal, you need to do something, either have your children at that time or you preserve your
Preserve.
fertility, so
Yeah.
yeah, that you have options in future.
Okay. Well, I think that's quite nice. Imagine going in for a checkup in the hospital, as people would say, and then you're quite young. Like I know someone who is quite young, just maybe early 20s, and you're already hypertensive. And you end up speaking with the doctor, and you're like, oh, this, and that. If you're thinking about being a parent in future, this can affect that. And I feel like that's the plus. You go into the hospital,
Yeah,
you
so
check
that
on
that will
those
even
things.
help the person be more serious with the counsel that is giving in terms of
Exactly.
lifestyle changes they need to
Exactly.
make, and
Mm-hmm.
even adherence to their
Yeah.
drug, so that they know that it's not something this can affect other things, so
Mm-hmm.
that they know they need to take their treatment seriously.
Seriously. Yeah.
Yeah,
And it's not just old age now that brings about this should I say medical conditions as well. Young people can still have
yeah,
it. You can still be hypertensive, you can
yeah.
still
So
be
lifestyle
diabetic.
very
Yes. So
important. Yeah,
you have to take all of that very seriously and quite important. But for parents out there or prospective parents or people
yeah.
that are thinking about parenthood in future, is there any key advice you can give them concerning delaying that parenthood?
Okay, so like I said, balance is key. Yes,
Mm.
we want you to be established by financially. We want you to be, established by reason of your career. Yeah, we know some people. This delayed parenthood is not intentional. For
Yeah,
example, a young
actually.
lady will not marry herself. She must get a suitable partner. Man
Yeah.
must come and tell her, "I want to get married to you." So
Mm-hmm.
sometimes some of the situations are not really in their hands.
Yeah.
Yeah, and when those situations are not really in their hands, that's why there's the option of fertility preservation. But if young ladies have this at the back of
Of their
their minds,
mind.
that there's a time that your fertility is maximal,
Mm-hmm.
that might help them to make the right decisions at that time in their life.
Yeah.
Yes, knowing that, at this time, if I plan to have children, this is the time I should have the children. And
Mm-hmm.
if I'm not able to have children at this time for whatever reason, then I should think of preserving my fertility.
Okay.
Yes, so I think it's important. So parents too, I know parents, especially in this climb, tend to put pressure on these young ladies when they get to a
Exactly.
certain age. Why bring your
Mm-hmm.
husband home?
I
Yeah,
was about
but
to say
yeah, we don't
that.
need to pressure them too much,
Yeah, there are
because when you
options.
pressure them, then they make the wrong choice, and
Mm-hmm.
then we as parents are the ones that deal with the heartbreaks and heartaches when they come later on. But there's an option that these women are not pressured,
Yeah.
but something can be done. They can preserve their fertility
Mm-hmm.
by banking their eggs at this young age,
Yeah.
so that they take their time to make the right choices with regard to their future partners and when to have their children.
And also something apart from not being pressured into that, I think yes, that's quite important. Just because there's a timing doesn't mean you have
Puts
to
yeah, it
rush
puts
and make the
yeah,
wrong
wrong
decision. That's why we're coming
exactly.
up with these options that you can
Yes,
use to preserve
exactly.
fertility.
Yes.
But this is a little bit out of scope, but since we spoke about marriage, how important do you think it is that couples come in to do a fertility test before getting married, just like you check for
Very,
genotype?
very important. We've seen a lot of wow, we've seen a lot of things. Very important,
Yeah,
yes. The
yeah,
way people do genotype testing, the way you screen yourself for some of these infectious diseases,
yeah,
people should come in for fertility testing because we've seen a lot of things
yeah.
that are happening now. Yes, like they say, some things don't show on the face. If you don't do the test, you will
True.
not know. So I think we're putting up a case for it. It should be part because a lot of
I think
religious
so.
organizations request for some of these tests. A lot of
Yeah.
them send these couples to us. Okay, want them to do their genotype screening, want them to do their blood group, want them to do their HIV screening,
Among the
hepatitis B, C, and
hepatitis.
so fertility testing and screening should also be
Be
part of
part of
it,
it.
so that everybody knows what they're getting into.
Yes. So you
Yes,
don't
so
come
that they're
later
no
on and you're blaming
exactly.
one person for this
Yes,
and
yes.
that,
So
and
I
then
think
you
it's a
know.
very important.
Yeah.
It's very important to.
Okay. Well, thank you so much, Dr. Debbie.
Thank you so much for having me.
It's always very nice to have you on set and to get
Thank
your
you.
insights on these topics. It's very important. Thank you so much for joining us and sticking with us up until the end of this. I hope it was as informative for you as it was for me. Your fertility options are out there. If you're not ready now, if there's any reason why parenthood might be delayed, there are solutions for that. So don't be too down on yourself or too high on yourself thinking that no, it couldn't be you, because I know Nigerians
It's always
we like
somebody
to do
else.
that, think it couldn't be you. So just put that into consideration. Thank you so much for joining us. We go live every Wednesdays and Fridays by 3 p.m. on YouTube, Facebook, Instagram, and TikTok sometimes. So please join us. Go on our pages, subscribe, like, turn on your post notifications, all of that. And of course, if you do want to see a fertility specialist, you can come into Alps Hospitals here in Jos and in Abuja, and we have our numbers on the screen for you, so you can book a consultation or have a video call or a voice call, anything. We're literally here for you. So make sure to do that today. Have a lovely day. Goodbye.